Hi, have you ever heard of the DARE program? Drug Abuse Resistance Education Program? Maybe they came to your school as a teenager and talked to you about the use of drugs. And every year we've made a promise never to use drugs. Well, how many of us have broken that promise and drink alcohol, or smoked cigarettes, marijuana, vapes, or at least know somebody who's done drugs? It doesn't make you a bad person if you drink alcohol, as long as you do it responsibly. But addiction is addiction. It's easy to fall victim to. In fact, addiction is unpredictable and it can happen to anyone at any time. While addiction is a disease, it is completely treatable, but it does have some long term effects. This speech is actually to inform the audience of the effects that drugs have on the body as well as the brain. We'll discuss the effects of several drugs that may have one or more types of health effects from usage. While I not only have personal experience with the use of alcohol, I also was a dental assistant. So, for several years, I worked with patients that suffered from physical effects from drug use. As I stated, addiction can happen to anyone. And some, if not all of us, know at least someone, whether it's a loved one or a friend, who is suffering from the effects of drug use and addiction. Drug abuse has damaging effects, and the lasting effects of drug use on the body can destroy vital organs and functions, ending in permanent disability or even death. Even legal drugs like alcohol taken in excess can have substantial complications that just can't simply be undone. And for illegal drugs, excessive use might not even be necessary for lasting damage to happen. Let's explore some of the common drugs of the world: alcohol, tobacco, marijuana, fentanyl, heroin, ecstasy. All of these are so accessible in the world today. And all of them can have some type of effect, whether it's physical or on the brain. Alcohol and drug abuse can have psychological and neuropsychological effects due to the damage of cells that produce the brain's chemical serotonin, which is important for regulating mood, appetite, learning, and memory. A study done by Bruce H. Price, MD, chief of the Department of Neurology at McLean Hospital in Belmont, Massachusetts, found that chronic ecstasy use may promote neuropsychiatric damage. Researchers actually indicated that repeated ecstasy use is associated with sleep, mood, and anxiety disturbances, memory deficits, and attention problems. A study found that evidence in a study found growing evidence that chronic use of ecstasy is associated with persistent mood depression. And the study also found that ecstasy use has long term psychiatric effects such as agitation, anxiety related manifestations, such as panic attacks, and OCD. Research done on chronic marijuana use has shed some light on how it may have some serious effects on the brain, body, and behavior. Since marijuana legalization is occurring across the United States, there has been a rise in the number of users, with more than half of American adults having tried marijuana at least once, and a whopping 35 million adults that are considered regular users. But it's just not the United States. Studies have shown that chronic marijuana use affects the same brain structure that is involved with addiction, and also found that significant increase in psychotic like episodes in teenage users and reported adverse effects on the cognitive development with increased symptoms of depression. Other studies have shown that chronic use can interfere with the normal development of the adolescent brain. Now that we've talked about some of the drugs that affect the brain, let's look at some drugs that can affect the body. About 23% of American adults engage in at least one heavy drinking day in the past year. And people who are regularly consuming intoxicating substances from alcohol to opiates put themselves at a higher risk of suffering physical harm. Some drug use can affect the person's oral hygiene, and a substantial amount of users harm their mouth and teeth due to dry mouth, which increases acid in the mouth, leading to enamel loss, acid reflux, which also rots enamel, grinding their teeth, increased ulcers, sores, and lack of oral hygiene causes cavities, gingivitis, and periodontist disease. Tobacco and alcohol use have been linked to oral cancer, which develops in the lining of the cheeks, gums, the roof of the mouth, tongue, and lips. Each year, 660,000 people in the United States are diagnosed with cancer related to tobacco use, and over 343,000 people actually die from cancer related to tobacco use. But that's nothing compared to the number of people that are dying now due to fentanyl, or should I say synthetic fentanyl. Synthetic fentanyl is 50 to 100 times more potent than any other drug and it can affect the brain and breathing and lead to fatal results. The chemical structure of fentanyl is just slightly different from that of heroin. Fentanyl was originally synthesized as a powerful pain reliever for after surgery care, but since has been manufactured for illicit use. It is legally sold as powders, dropped on blotter paper, put in eye drops, nasal sprays, or pills, and is the most lethally illegal drug in the United States. Long-term use isn't necessary for fentanyl users, but it does have damaging effects, and the addiction rate is so much higher than any other drug. And unfortunately, so are the death rates due to the effects that it has on the body, which include respiratory depression and oftentimes death. Whether it's long term use, short term use, legal or illegal substance use, every drug can affect the person differently. And while some of it may be psychological, neuropsychological, or physical effects, the risk never outweighs the reward. Addiction is a disease, but it can be treated. So the next time you think about picking up a cigarette, vape, bottle, or anything else, remember that now you know the potential risks. In my opinion, sleep is better for the mind and body than any other drug. Thank you.